Hello, gentlemen. Let's be honest for a moment. Have you ever wondered if masturbation after 60 is actually harmful? Could it be silently draining your testosterone, affecting your prostate, or even causing permanent damage to sensitive nerves? This is a very common concern. And I'm Dr. Hale, a urologist specializing in men's health after 60. In this video, I'm going to reveal a safe method I call the gentle grip technique, way to enjoy pleasure without causing harm. Well, actually, improving your overall sexual health. I know many of us make a critical mistake without even realizing it. One that makes you feel the more you do it, the weaker you get. I'll show you what that mistake is and how to fix it in just a few minutes, so be sure to watch until the very end. I have a little morning routine that will help you increase your testosterone naturally. Before we dive in, do you ever feel a lack of energy or vitality? If so, comment yes below. And while you're at it, be sure to subscribe and hit that notification bell so you don't miss out on my valuable health advice. Now, go grab your coffee or tea, get comfortable, and let's explore the changes our bodies go through after 60. So, let's get started. Gentlemen, have you ever felt like your body is just different? Maybe you're not as interested in sex as you used to be, or things just don't feel the same. This isn't in your head. It's a natural part of aging, but it's crucial too. Understand why so you can take control. The first thing we need to talk about is testosterone. Think of it as the fuel for your masculine engine. After age 40, your testosterone levels naturally decline by about 1% each year. By the time you're over 60, this drop can significantly impact your sex drive, your energy, and even your ability to get an erection. This isn't a myth, it's a proven fact. For example, the Cleveland Clinic confirms that this decline is a primary cause of changes in libido and erectile function as we age. Now, let's connect this to masturbation. Many men believe that masturbating too often can drain their testosterone. This is a common misconception. In reality, regular sexual activity, including masturbation, can actually help maintain healthy blood flow and hormonal balance. The real issue isn't the act itself, but how you do it. And what else is going on in your body? The second major change is blood flow. Your arteries and veins can become less flexible and more rigid over time. This reduces circulation, which is vital for achieving and maintaining a firm erection. The Harvard Medical School reports that over half of men over 60 experience some form of erectile dysfunction. That's not a sign of failure. It's a sign that your body needs a different kind of support. Finally, your nerve sensitivity changes. As you age, the nerves in your penis can become more delicate and prone to damage, especially from rough handling. This can lead to a desensitized feeling, making it harder to feel pleasure. So, if you've been relying on a death grip, you could be doing more harm than good. But don't lose hope. A great first step is to focus on your blood flow. Something as simple as a brisk 30-minute walk each day can do wonders. Get your heart pumping, improves circulation, and sets the stage for a healthier sex life. Remember, small, consistent actions are what create lasting change. In our last segment, we talked about the natural changes your body goes through. Now let's get to the mistakes that can turn a healthy, natural act into a problem. I'm talking about the common errors that can make you feel the more you do it, the weaker you get. The number one mistake I see is what's known as the death grip. Many men, often without realizing it, use a very tight, constricting grip during masturbation. Maybe you've started this habit in your younger years, or perhaps you're doing it to try and get a stronger sensation. But here's the problem. It damages the nerves. Over time, this intense pressure can desensitize the nerve endings in your penis. As the nerves become less responsive, you need more and more pressure to feel anything, creating a vicious cycle. This isn't just a myth. Urologists know this can lead to a condition called penile nerve entrapment, which can make natural, gentle touch during sex feel unsatisfying. Another common mistake is excessive frequency. While there's no magic number, masturbating multiple times a day can put a strain on your system. this isn't about running out of anything. It's about the physiological recovery time your body needs. Too much activity can lead to a state of fatigue, which can negatively impact hormone levels and your overall energy. Finally, relying too heavily on pornography. For some men, overconsumption of intense graphic content can desensitize your brain, not just your nerves. Your body becomes accustomed to extreme visual stimulation, making it harder to respond to the natural, intimate sensations of a partner, or even your own touch. This can lead to a type of performance anxiety, or even a form of erectile dysfunction. The good news is, these are correctable issues. The first step is awareness. A simple change in your grip can make a world of difference. Try a gentler, more open-handed technique. It might feel different at first, but with practice, you can retrain your nerves to be more sensitive, helping you regain natural sensation and confidence. So far, we've talked about how small mistakes can have a big impact on your body. But in just a few moments, I'm going to show you exactly how to apply the gentle grip technique to protect your nerves and prostate for years to come. Don't go anywhere. Now that we've covered the common mistakes, let's talk about the solution. This is where you take back control and start protecting your body for the long term. I want to introduce you to a method I recommend to all my patients, the gentle grip technique. It's about more than just pleasure. It's about preserving nerve sensitivity and improving blood flow. So, what does this technique look like? Think of it this way. Imagine you're holding a raw egg in your hand. If you want to, hold it firmly enough so it doesn't slip and fall, but gently enough so it doesn't crack. That's the exact amount of pressure you should be using. This light, intentional touch helps protect the delicate nerve endings we discussed earlier, preventing desensitization and allowing you to maintain natural responsiveness over time. Another key component is using a high-quality, water-based lubricant. This might seem like a small detail, but it's crucial. Dry friction is a major culprit for nerve irritation and microscopic skin damage. A good lubricant minimizes that friction, making the experience not only more comfortable, but also safer for your body. Finally, incorporate deep, diaphragmatic breathing. As you engage in the act, focus on slow, deep breaths. This simple practice increases oxygen flow and blood circulation throughout your body, including to the pelvic region. Better blood flow is essential for erectile function and overall vitality. And deep breathing is one of the easiest ways to support it naturally. By adopting this technique, you're not just avoiding harm. You're actively promoting your own health. You'll protect your nerves, maintain a natural sensitivity, and improve the blood flow necessary for a healthy erection. This is about building a sustainable, long-term approach to your sexual health. It's about listening to your body and treating it with the care it deserves. So, start today. Focus on a gentle grip, use a water-based lubricant, and breathe deeply. Small changes like these can lead to a lifetime of better health and confidence. Gentlemen, we've talked about what not to do. Now let's get to the good news. When done correctly, masturbation isn't just a healthy part of your life, it can be a powerful tool for your health. I want to clear up a common myth right now. Regular masturbation does not harm your prostate. In fact, a growing body of scientific evidence suggests it may actually help protect it. Let's look at the science. A landmark study from Harvard Medical School found that men who ejaculated frequently had a 20% lower risk of developing prostate cancer. The theory is that regular ejaculation helps flush out potential carcinogens and keeps the prostate ducts clear and functioning properly. Think of it as a natural cleanse for your prostate. This is a powerful, proactive step you can take to protect your long-term health. Beyond prostate health, the benefits extend to your entire cardiovascular system. Regular sexual activity, including masturbation, improves blood flow. This is crucial for men over 60. Good circulation is essential for both your erectile function and your overall heart health. By stimulating blood flow to the pelvic region, you're helping to keep those arteries and veins healthy and flexible. It's a natural workout for your vascular system. But the benefits aren't just physical. The act of masturbation releases endorphins and oxytocin, the body's natural feel-good chemicals. This can significantly reduce stress, improve your mood, and help you get a better night's sleep. In a world that can be full of anxiety and pressure, this simple, healthy practice can be a great way to maintain your mental and emotional well-being. So, don't let misinformation hold you back. The key is to practice safe, gentle techniques. You're not just finding a moment of pleasure. You're actively supporting your prostate, your blood flow, and your mental health. It's a win-win. We've covered the how. Now, let's talk about the big picture how to build a sustainable lifestyle that supports your sexual health for years to come. This isn't just about one technique. It's about a few simple, daily habits that can have a massive impact on your erectile function after 60. First, let's address frequency. A common mistake is thinking you need to be active every single day. That's a myth. For most men, a recommended frequency is 2 to 4 times a week, whether with a partner or alone. This range is enough to keep blood flowing, maintain prostate health, and prevent desensitization without overtaxing your body. Remember, consistency is more important than intensity. Next, focus on your body's foundation. You can't build a strong house on a weak foundation. That means staying hydrated. Dehydration can significantly decrease blood volume, which is essential for achieving an erection. A simple tip: carry a water bottle with you and make sure you're drinking consistently throughout the day. Another cornerstone is regular exercise. You don't need to hit the gym for 2 hours. A brisk 30-minute walk, light jogging, or cycling a few times a week can dramatically improve your cardiovascular health and, by extension, your erectile function. Exercise directly boosts blood flow, which is the key to both your heart and your penis. Finally, a major mistake I see is men reaching for quick fix pills without consulting a doctor. Many over-the-counter supplements are unregulated, ineffective. Or worse, they can interact negatively with your existing medications. Before you try any medication, talk to a healthcare professional. A real doctor can help you find a safe and effective solution, whether it's lifestyle changes or a prescription. It's right for you. Your sexual health is a reflection of your overall health. By focusing on these small, practical steps, maintaining a healthy frequency, staying hydrated, exercising, and avoiding unverified supplements, you're making an investment in your energy, your confidence, and your vitality for the future. Gentlemen, what you've learned today is that true vitality isn't a lost cause after 60. It's a choice. It's about understanding your body and making small, conscious decisions every day. We've unmasked the myth that masturbation is harmful and shown you how the gentle grip technique can be a powerful tool for preserving your nerve sensitivity and protecting your prostate health. Your body has served you for decades. And now is the time to listen to it with kindness and intelligence. Don't force it. Don't ignore it. Instead, build a habit of gentle, consistent care. The one thing I want you to take away is this: your health is a journey, not a destination. So, start today by simply drinking a full glass of water every morning as soon as you wake up. This small act of hydration can kickstart your circulation and set a positive tone for the day. Be patient with yourself. Trust the process, and remember, a fulfilling life at any age is always within your reach. If you found this video helpful, please give it a thumbs up and share it with a friend who might need to hear this message. And if you have any questions, leave a comment below. My team and I will be there to help. Don't forget to subscribe to the channel and hit that notification bell so you can continue this journey with us. I'm Dr. Hale, and I'll see you in the next video.